Good morning to all of you. I hope you're all having a nice day so far today. My name is Veronica Arofeva, and we will be looking at the anatomical muscle movements of an equestrian rider. We will start by focusing on the posting trot. As you can see here, the individual posts up and then sits down before repeating the whole process once again. While the rider posts up, we have multiple muscle groups working together. First, we will look at the hip extension that occurs with the bicep femoris and the gluteus maximus as the agonist and the rectus femoris as the antagonist. You can also notice the knee extension, which is coming from the rectus femoris agonist and the bicep femoris antagonist. Moving along, we see that as the rider sits back down into the saddle, the hip flexes, and so the rectus femoris and the quadriceps are the agonists, while the bicep femoris and gluteus maximus become the antagonist muscles. We also see knee flexion, which is the bicep femoris agonist and the rectus femoris antagonist, at the same time as we see the varus knee external rotation of the sartorius muscle being the agonist and the rectus femoris being the antagonist. While we are looking at this representation, we can also take note of the typical equitation position, where you will see the hip adduction and knee flexion of the adductor magnus agonist and the gluteus maximus antagonist. There's also dorsiflexion of the ankle, which occurs from the tibialis anterior agonist versus the peroneus longus and the tibialis posterior antagonists. The typical equitation upper body position includes the flexion retraction of the scapula in order to bring your shoulders back, which involves the rhomboids as the agonist and the serratus anterior as the antagonist. There's also a flexion and adduction of the humerus, which comes from the subscapularis, which provides the internal rotation, and then the pectoralis major and the anterior deltoid, which provide the forward arm motion and the midline adduction. These are agonists towards the supraspinatus and the latissimus dorsi and the posterior deltoid, which act as their antagonists. Moving on, we see valgus elbow flexion, which comes from the brachialis and biceps brachii that have an antagonist of the triceps brachii. There is also phalanges flexion, which comes from the flexor digitorum profundus and superficialis, which are agonists towards the extensor digitorum. Here we can continue to the technique of cueing a lead change after the jump. You can see that as the horse lands on the incorrect lead, in other words, their leg position is incorrect, the rider needs to correct it by asking for a lead change. As one of the first cues, we have a varus knee external rotation, and that is completed by the sartorius muscle, which is an agonist towards the rectus femoris and the vastus medialis, lateralis, intermedius muscles. Following that, there's an external lateral hip rotation, which is conducted by the gluteus maximus and antagonized by the adductor longus and brevis. There is also knee flexion, which occurs from the adductor magnus, the agonist towards the rectus femoris. In order to complete the lead change, there must be a shoulder extension where the hand is drawn back using the latissimus dorsi and the posterior deltoid and teres major muscles. These are agonists towards the anterior deltoid. Now you can see that the action is completed and the horse is able to change leads. Finally, we will examine the posture and technique needed to excel over a jump, in other words called the two-point position. As the body enters the two-point position, there is hip flexion, which comes from the iliopsoas, acting as the agonist versus the gluteus maximus and semitendinosus, acting as the antagonist. Then there's a noticeable anterior pelvic tilt, where the tensor fascia lata is the agonist towards the gluteus maximus and the adductor magnus posterior. At the same time as that, there's a lumbar extension that occurs using the erector spinae, and that is the agonist towards the rectus abdominis muscle. In the two-point position, the back must arch as well, so there is a bilateral vertebral extension using the longissimus dorsi or thoracis muscle, which is the agonist towards the rectus abdominis muscle. From here, we will ignore the muscles during the release of the position and look at another example over a jump. After entering the position, you can also see knee flexion, which comes from the adductor magnus in order to prevent the loss of the proper 2-point position by not allowing the straight leg to occur. The adductor magnus is the agonist towards the gluteus maximus, which is the antagonist. There is also elbow flexion, which comes from the brachialis and biceps brachii and antagonized by the triceps brachii. The hands must also give a release towards the face of the horse by using the pectoralis major and anterior deltoid muscles that provide a shoulder and chest flexion. These are antagonized by the posterior deltoid. Finally, there is a vertebral neck extension, as the rider must look up and not continue staring at the horse's neck using the splenius, and antagonized by the longus capitis and the longus colli. We now see a release from the position after the jump landing. I hope you enjoyed the brief analysis of the anatomical muscle movements of an equestrian rider, and here are the credits. Thank you guys for watching.